Hello, my friends. We're back with the same topic, which is the torsion directly made to the arch wire, to the rectangular arch wire, obviously, because if it is a round arch wire, it won't matter if you do this torsion or not, because it won't make a difference, okay? In this case, we're doing the torsion in the arch wire, in the rectangular arch wire, in order to achieve some kind that we desire to, some kind of inclination of this segment of the arch wire, to have a relationship between this angulation, this inclination of the arch wire and the inclination of the slot. So this is the most important thing. So I always say the same thing to you because I consider this very important. The relationship between the torsion of the rectangular arch wire and the inclination that this rectangular arch wire will find when it goes inside the slot. So we have the slot with very varied inclinations. We can do this, do that, and we have this difference in the relationship between the inclination of the torsion of the arch wire, meaning this is my arch wire, this is my hand representing the rectangular arch wire, and this is the slot, okay? So this is what I mean. When I do this or that, we do positive or negative inclinations here in the arch wire, and when it finds a different inclination here of the slot, which is obviously related to inclination of the teeth or tooth, we will have a different relationship. We can have many different relationships between this inclination here, real torque, and the inclination here. And this relationship, we call it a relative torque. So sometimes it has nothing to do with the real torque. We may have a real torque, a positive real torque, upper arch positive real torque, and we have here a passive relative torque. I'm jumping a little bit ahead because I want you to understand that the most important thing here is to understand the relationship between the real torque, the real torsion of the arch wire of the segment that we are doing the torsion, and the relation between it, the torsion, and the inclination of the slot. We have the bracket, we have the slot, and we go inside the slot with this wire, and this relationship between the inclination or torsion, meaning torsion of the rectangular arch wire, and the inclination of the slot. This is what matters for us. But we have to understand the real torque. We saw that the real torque in the anterior segment of the arch wire, we can measure it, we can evaluate it, and we can sometimes even measure the inclination, the torsion. I'm going to show it you here when I'm going to say, when I say about the posterior torque, the posterior real torque, the posterior segment of the arch wire. Now we're measuring, we are evaluating this torsion. Here we have no torsion at all. So as you can see, we grab here the posterior segment where I want to evaluate, where I want to assess. I go with my plier, 142 plier in this case, and I grab it here. I seize it here, and now I see what is the relation of inclination or angulation. I have this always this mixing of words, inclination and angulation. It may seem that they are both the same, but they are not. Inclination, it means the buccal, palatal or buccal lingual inclination of the teeth, and the angulation is the mesial distal angulation of the teeth, or in a specific tooth. So inclination is related to the third key of normal occlusion, which is the inclination of the teeth. And here we refer to the same thing. As I told you before, when I refer to torque, sometimes I know I have this confusion. I say torque meaning inclination of teeth, and this is the same thing in orthodontics. We are used to saying the same thing, to refer to the same thing when we refer to torque, the torsion of the arch wire itself, and the inclination of the crowns. And I told you before also that I'm representing here not negative or positive, so the signals are related to the inclination of the crown. I know many people refer to the inclination of the root. So sometimes we say a positive real crown torque, a positive real relative crown torque, a positive, I'm sorry, a positive relative crown torque, positive relative crown torque, because it is what the tooth that we are moving, or the group of teeth we are moving, what this is what they will do. They will do the inclination. The torsion of the arch wire will manage to do the inclination of those crowns. So I prefer to refer to the crown because this is what we see. This is directly what we refer to when I'm going to do some kind of adjustment in my group of teeth to do this correct refinement or intercruspation. Okay, so I'm referring to the torsion of the arch wire, and sometimes I say the inclination referring to the torsion. Same thing for us, and we will get used to doing the same way because we refer to positive, negative inclinations, which we do all the time in our day-to-day practice. We do it all the time. We do this kind of inclination to adjust some bad positioning of our teeth. And this inclination we refer to the crown because it's what we see directly. It's in what we are working in our day-to-day practice. We don't see crown, we don't see roots. We know the root is going to do the movement, but we refer as, and we meaning me and here with my students, and many people in the orthodontic field do the same. I know that there is a huge amount of orthodontics that refers to the root, but when I say negative or positive buccal or lingual inclination, I'm just referring to the crown. Okay, just in order not to need to all the time say buccal crown torque, I'm going to say buccal torque. This is crown. Okay, so let's move on. And here we have the, coming back to our explanation here, here we have the neutral posterior real torque. So the neutral posterior real torque is no torsion of the rectangular arch wire in the posterior segment of our arch wire. So we have no torsion. It's like we buy it from a company and we put it in our stock. So this is how it comes for us. It comes neutral, unless you buy some different kind of a different brand of arch wire that already comes with torsion. It's not common. It's not something that I'm used to seeing in my country at least. Okay, so in this situation we have no torsion. It may be it may seem a little bit silly for you that I keep just repeating these concepts, but I think it is important. And the way I teach is like this: I go and I go back, and I remember that I told you before something, and I go there where I told you and say, do you remember that thing that I told you before? And this is the way I learn. And I think it's important for you to understand. This is the way I learn and the way I teach. I have to go and go back again and refer to some concepts again and remember and remind you that concept is important. So this is the real torque, and this is the evaluation of the posterior real torque, the posterior arch segment real torque, or torsion, the real torsion of the rectangular arch wire. When it goes like this, it goes up when I grab the posterior part of the arch wire, and it goes in the opposite end, in the opposite tip, it goes up. So if I put my plier in a horizontal position related to the horizontal, the floor, when I go like this, and I grab here in the posterior part of the arch wire, the opposite tip of this wire, it goes up. And again, this is something related to the upper arch wire. We refer to this as a positive real torque, because when we put it here like this in our posterior segment of upper teeth, it tends to incline posterior teeth buccally. So think of this image here. If I grab the posterior segment, the opposite posterior segment, it's not being grabbed here. When I go down with it, when I go to the level of the tube, in this part, meaning the opposite part of the arch, in which this tip here is inserted, in which this rectangular wire is inserted. So think of it. When I have it here, it is up. When I go like this, look at my hands. Look at my hands. So this part of the arch, this part of the bracket is going to feel, it's going to suffer a torsion, it's going to suffer a couple, which is generated by these 2 points of the arch wire touching opposite points and distant points of our bracket. So this is something that tends to move, tends to incline those teeth in a buccal direction, towards buccal, okay? So this is why we call it a posterior real torque, posterior real positive torque. So this is for the upper arch. If I am inserting the same arch in the same position, so in the lower arch wire, for example, this is, if I'm going to insert it in the lower arch wire, this is the left side of the arch wire, okay? I'm going to insert like this, and it goes up here. Same thing. I go down to the level of the tube, and we go like this with the crown. We go like this, meaning inclining the crown towards lingual. So this is a negative torque, meaning I have to feel, I have to read the torque all the time when I insert the arch wire inside a slot. So just for remember, you can have many situations, many inclinations that you find in your teeth and find in your, of course, the same thing will happen to the slot. So we have many different possibilities. We have all the time to remember to read the torque, to read the position in order not to mistake, in order to commit some mistakes in our treatment, okay? So this is for the posterior part of the upper arch wire here. I mean that I have here a posterior positive real torque. Posterior positive real torque, okay? So if this is inserted this way in the lower arch wire, we consider this a posterior real negative torque, okay? So what do I have to do, Kleber, if I want to have a posterior torque in the lower arch wire? We invert like this. We go upside down. We put this way, not this way. So we have here, for the lower arch wire now, we're going to have a positive torsion, a positive real torque, okay? But you have to remember that I'm not saying that every time that you insert the wire like this, you will have always a positive torque in the upper arch here, or a positive torque in the lower arch here. I'm not saying that. I'm just saying that in the average situation, we will have, when I do this kind of torsion, a real torque, we will have in an average situation a positive torque here to the teeth, a positive inclination, meaning inclination to the buccal, and here, if I'm using it in the upper arch wire, and here I'm having a negative inclination. Just think of it. Grab the arch wire in the posterior segment and think, when I'm going to a horizontal position of the arch wire, meaning I'm going to the level of the tube in which it will be inserted in a clinical situation, it goes to the tub, so we have here this, okay? So posterior, I put it here in the posterior part of the arch wire, the upper arch. I inserted this wire here, and it goes down in the opposite end. When I come like this, when I do like this, I'm going to have a negative a tendency to a negative torque, to a negative inclination of the crowns, of the posterior crowns. So that's why we call it a real positive torque here to the upper arch. And if it's the same upper arch here, this is called a negative, real negative crown torque, okay? Same always about the crown, meaning always about the crown, okay? So let's see here. Take a picture of this image here and you won't forget. So when I grab the posterior segment of the arch wire here, okay, and it goes up for the upper arch, it is considered a positive real torque. If I put it the same way in the lower arch, it will apply in an average situation, it will apply a negative crown torque, okay? Always real torque, okay? And here, for the upper arch wire, for the upper arch, if we grab our arch wire in the posterior part of it, and this side, of course, in this side, when it goes inside the tube, inside the brackets, and we go up with the opposite end, opposite tip, and we go up to insert in the opposite tube, in the opposite brackets, we're going to, in an average situation, we're going to have a negative crown torque. So that's why we call it negative real torque, because in average, we're going to apply a negative torque to these crowns here, okay? The crowns in which this part, the segment of the arch wire is inserted. Okay, so here it's down, upper arch, I'm putting inside the molars, the tube of the molars and the brackets of the bicuspids. So it goes down in the other end, posterior arch, I'm going up here. The tendency is a negative torque. So we call it a real negative crown torque. The opposite to the, here is lower arch, I'm sorry, here is lower arch. If I'm putting this here in the lower arch like this, it goes down in the opposite tip of the arch wire, and we go horizontal, we apply a torsion, we apply a couple, which is going to generate a tendency of inclining those crowns buccally. So it is a positive real crown torque, okay? As I told you before, it doesn't mean at all that this is the case for all teeth, because the inclination of those teeth may change this torque, this relative torque, which we didn't study yet. So we are going to see about this in the other classes, in the next other classes. Here we're just we're just giving a name to the real torque, to the real torsion. So we can have it positive, we can have it negative, or we can have it neutral. So the torsion can be neutral, no torsion, positive or negative, and it will depend, the name will depend if positive or negative. It will depend on the reference that you use. So upper arch is, which is positive to the upper arch, if you go with the same arch wire, not changing not inverting it. If it goes this way, here is positive for the upper, and for the lower it is negative. So if I want to have a positive here, this is how it goes. Upper arch, it goes negative, okay? I'm just mimicking here, trying to get it a little bit more clear, but I know it's not easy. I promise you, things will get easier once we reach another part of our explanation, when we start saying about the relative torque, okay? So for now, it's just this: negative, positive, or neutral real torque, real torsion of the rectangular arch wire. See you in the next class. Bye-bye.